I want to thank Premature, your one-stop shop for sexual wellness, for sponsoring this video. So before I get started, I want to explain how long do people normally last in bed? What's average? So if you've watched my last video on the average duration of sex, you know that the average time that someone takes from the beginning of vaginal penetration to the end is about 5.7 minutes. So that's average. So if you're doing that and you're comfortable with it, that's totally fine. However, when you look at surveys where they ask people how long they want sex to last, it's anywhere between 7 to 13 minutes. Today we're going to talk about how to deal with something called premature ejaculation, which will essentially help you last longer in bed. However, before you go down the rabbit hole or even watch the rest of this video, make sure that's something that you and your partner both want. If you are both completely satisfied with how long sex lasts for you, you do not need to do anything or change anything you're doing. And also talk to your partner about what kind of stimulation they want. Maybe it's not just penetrative sex. Maybe they want oral or manual or to bring some sex tools into bed with you. So make sure you talk to them and find out other ways that may be equally pleasurable or more pleasurable than having longer penetrative intercourse. So when should you consider using the tools in this video to help you? Well, in medicine, when ejaculation happens sooner than you or your partner want, we call that premature ejaculation. And when you look at studies, you see that about 30% of men struggle from premature ejaculation. However, only 9% actually go see their doctor about it. So how do we define premature ejaculation? Well, there's three major components to it. One is having ejaculation within 1 to 2 minutes of penetrative intercourse. Number two, the inability to delay ejaculation in nearly all sexual encounters. And number three, that this should cause some negative personal consequences like bother, stress, anxiety, things like that that are actually causing you distress. That's considered primary premature ejaculation, meaning you've had that problem your entire life. Sometimes people can get what's called secondary or acquired premature ejaculation. And that's when you've previously had normal ejaculatory function, meaning you've had a normal duration of sex, and all of a sudden you start developing a shortened time to ejaculation, usually less than 3 minutes after vaginal penetration. And this is something that may be consistently seen after a certain time period that's causing you bother and is very different from the way you used to ejaculate previously. Well, there's evidence to suggest it's due to abnormal transmission of a chemical messenger in the brain called serotonin. When people have premature ejaculation, they have receptors that respond to serotonin that happen to inhibit ejaculation or stop ejaculation from happening. And these receptors don't work as well. Also, it's important to understand how ejaculation happens. Ejaculation is a reflex, meaning that your body automatically ejaculates in response to certain things. And in this case, it's usually friction, as well as how your brain is perceiving that friction to feel, i.e. pleasurable. This reflex is organized by an area called the spinal ejaculation center, which is located in the spinal cord. So when you have these stimulations, it sends signals to the spinal ejaculatory center, which takes that plus other information from the brain as to what you're thinking about the situation, and it triggers the ejaculatory reflex. Also, if you want to learn how semen is made and how it actually gets forced out of the body, make sure you check out my video on how semen is made. Ultimately, premature ejaculation is a super stressful problem. And when you look at data on this, you see that men have tried at least 5 or more things before seeing their doctor about premature ejaculation. But when you see your doctor, are there certain tests that they're going to do? There's actually no diagnostic testing that's necessary in order to diagnose premature ejaculation. It's what we call a clinical diagnosis, meaning we'll talk to you exactly about what's changed in your ejaculation or how it's always been, and kind of understand a little bit about what's going on. And if it does fit in the definition of occurring earlier than usual and causing you bother or distress, then that's a reason to go ahead with treatment. So what treatment options are available? Well, number one is either psychotherapy or sex therapy. The reason for this is things like depression, stress, anxiety, guilt can really impact the time to ejaculation. So it's important to take into consideration how your mind is perceiving sexual activity with your partner. Fixing these issues with the help of a psychotherapist or sex therapist can be extremely helpful. As always, I'll link down a website which can help you find a sex therapist near you. People who do end up seeing a psychotherapist or sex therapist, in addition to the next treatment option, have an 8 times increase in their time to ejaculation. A next treatment option is called the stop-start method. And what this is when you're getting close to ejaculation, your partner squeezes your penis until the erection partially goes away. You do this about 3 times until you finally allow yourself to ejaculate. Do this continuously 3 times a week until you see that you've increased the time to ejaculation. Sometimes seeing a pelvic floor physical therapist, in addition to doing these treatments at home with your partner, can be even more helpful because they can help you identify the muscles that can potentially control ejaculation. As far as medical therapies, the first line therapy is topical anesthetics. And what these do, they're numbing agents that you put on the penis. And what they do is they actually diminish the sensitivity of the glans penis, so you're getting less sensory information from the penis to the spinal ejaculatory center, hence inhibiting that reflex from going. The first option for topical anesthetics is delay sprays. These are great because you can get them over the counter without a prescription. And my favorite product is Promescent. It's the only delay spray in the United States available over the counter that's been clinically studied, and you can buy it without a prescription. Their study was led by Dr. Kristen Mark, and the study protocol was approved by the Institutional Review Board at the University of Kentucky. In their study, they recruited 195 men through their extensive network of people seeking to have longer-lasting intimacy. 91 of those men were sent a sample of the product and asked to use it every other time they had sex. They also asked them to fill out a daily electronic survey. Before they started the study, they had to answer a bunch of questions about how long it usually took them to ejaculate, as well as several validated questionnaires or questionnaires that we use in research to assess if someone has premature ejaculation. The question they asked is how much time passes between the start of penetration with your partner to ejaculation. At the beginning of the study, participants reported their average time was about 6.5 minutes. After the study, their time went up to about 11.5 minutes, so clearly a longer time after using the product. Interestingly, they also asked about the rate of orgasm when using this product. And what they found was that the rate of orgasm of both partners went from 44% to 66% after using the product. It's super easy to use. It uses a specialized metered dose spray, and what that means is that you get the same dose with each and every spray. You start off with 3 sprays to the glands of the penis at least 5 minutes before sex, and you can titrate that dose from anywhere from 1 to 10 sprays per session until you get the right duration of sex. They use a proprietary target zone formula. Now, what does that mean exactly? Well, they have a eutectic spray, and what that is essentially is 2 different substances that are mixed together to make an oily substance on their own. They don't need any other solution or what we call solvent to dissolve the substance in, which means that you get a higher concentration per spray and it works faster. That's why you can use it as quickly as 5 minutes before sex, and you don't need to wash it off because it starts getting absorbed so rapidly. Of course, if you are going to use it for oral sex, make sure you wash it off before your partner begins oral. And the best part is it has very little risk of transferring to your partner, so your partner won't get any numbness after you've used it. Promescent patented this technology, making them one, if not the best available options on the market today. If you're interested in trying it out, check out Promescent at www.promescent.com/Rena for 15% off your entire purchase. You can get a whole host of sexual wellness products here, not only for you, but your partner as well. Condoms, lubricants, and so much more. You get free shipping over $10 in the United States, and it arrives in discreet packaging, so no one needs to know what you're getting, especially if you've got those Snoopy neighbors. Your purchase is covered with a 60-day money-back guarantee. If you use it and don't love it, they'll give you your money back. There are also other topical anesthetics available, particularly by prescription. In the United States, you can get Emla cream, and in Europe, you can get Fortassin. Emla is an off-label cream, so it's not approved technically for premature ejaculation. It also has 2 anesthetic or numbing medications in it. You apply it about 20 minutes before sex, and you do need to wash it off before use. Side effects for this medication include some penile numbness and sometimes a little bit of irritation. For our European viewers, Fortassin is actually approved by the European Medical Association for premature ejaculation. It also includes 2 numbing agents that is made into a, again, eutectic spray for use for premature ejaculation. Because of that, it's also fast acting and can be used within 5 minutes of sex. But again, this does require a prescription from a doctor to obtain. Moving on to our next treatment option is antidepressant medications. And you may be wondering why exactly antidepressant medications, but it's because they all work on serotonin, or preventing the uptake of serotonin, so more of it's around to then work on those receptors that are maybe not responding as well, so you can get more of a delay before ejaculation. Certain antidepressants called selective serotonin reuptake inhibitors, or SSRIs, are prescribed daily. These are often fluoxetine, paroxetine, or sertraline. These are prescribed by your doctor off-label because they're not actually meant for premature ejaculation, but they have the side effect of delaying ejaculation. Typically, if you take it daily, you will need about 5 to 10 days after starting the treatment before you notice a difference. And that may continue to improve for up to 2 to 3 weeks after you start the treatment. You usually start on a low dose and then titrate your way up. Side effects include fatigue, or being tired, having some increased yawning, nausea, and some diarrhea potentially, or some increased sweating. But the most important and bothersome side effect is sometimes people notice a decrease in libido, which is clearly not desired if you're trying to improve your ejaculatory latency time, or the time before you ejaculate. Usually you'll notice these side effects early on, and they tend to disappear after about 2 to 3 weeks, but it is something to look out for. You can also take certain medications on demand, meaning before sex. The first on-demand medication is called clomipramine, and what this is it inhibits the uptake of serotonin as well as another chemical messenger called norepinephrine. This is taken about 2 to 6 hours before sex, and it also has shown significant increase in ejaculatory latency time. Similar side effects to SSRIs, so you need to be on the lookout for those. Another medication is called duloxetine, which is not available in the United States. It is available in Europe and other countries around the world, so check if you do have it available to you. This one is shorter acting, so you can take it a little sooner before sex, so you don't have to take it 6 hours before, and it works quickly. However, many people get frustrated when taking these medications. They may find that it's not as efficacious as you thought it was going to be, meaning it doesn't work as well, or that they're spending a lot of money, or they're just frustrated that they have to take a medication at all. I will say that if you are struggling with erectile dysfunction or a difficulty getting an erection that's firm enough to penetrate your partner, then you want to treat that first with medications like sildenafil or tadalafil. And you can check out my video to learn more about those medications. But typically, treating the erectile dysfunction also helps with the premature ejaculation. There's also 2 other off-label therapies that are used for premature ejaculation. The first one is called tramadol, which is typically used for pain control. And part of the mechanism of action is it weakly inhibits the uptake of serotonin. It's used on demand, meaning you take it 1 to 2 hours before sex, anywhere between 20 and 100 milligrams. While studies have shown an improvement in ejaculatory latency time, the studies were not really high quality. And you do